When you talk about Medicare Advantage, you're going to hear people that you know that'll say, I love Medicare Advantage. It's so fantastic. And then you'll hear other people say, I hate Medicare Advantage. It's terrible. And they're probably both right. We want to get you the right plan at the Medicare Family. It doesn't cost anything to work with us, and we want to find out what's the best plan for you. With Medicare Advantage, the key thing that you have to keep in mind is that there will be a network of doctors and hospitals. So if all your doctors and hospitals are already in the network, slam dunk, we love that. If a couple of your doctors are in the network and a couple of them are out, it still might be a really good option for you. But we want you to fully understand all your options. Medicare Advantage is not the greatest. Medicare Supplement is not the greatest. They're all good. They're all good plans. We sell thousands, tens of thousands of both types of supplemental policies a year. What I sell your husband might be completely different than what I sell you because you're different people. I'm not here to tell you that Med Advantage is the greatest or Med Supplements are the greatest. They're both wonderful options to supplement original Medicare. Take some time. It's free to talk to us. Let our specialists here at the Medicare Family run you a variety of options and talk to you in detail about your needs and what the plans might be able to do for you. Medicare Advantage is based on your zip code in your county. So once you tell us that, we can tell you what's available.